Hi, welcome back. We will start now with part 2 of external application series, which follows part 1, where we have understood the aphorism till 198. So let's start. Now again, I want you to consider another imaginary case, a case of a patient who comes to you with a chronic wart or ulcer or long-standing any skin eruption, whatever is coming in your mind, any skin eruption you consider. Before any proper homeopathic case taking is done, the lesion is removed surgically, not by you, any surgeon. It has been cauterized or it has been suppressed with a strong local application. What happened next? Most people would say the problem has been solved. The patient will say, okay, I had this wart, I removed it surgically. It is not an issue for me. That is not a problem. My major problem is this. But Hahnemann, and as we are the disciple of Hahnemann, we disagree to it. We believe that by removing the local manifestation too early, we lose one of the most valuable clues of the patient disease, right? Think of it like a detective trying to solve a mystery. If the most important piece of evidence suddenly disappears, solving the case becomes much more difficult. The same thing happens in homeopathic prescribing. The local lesion, after containing certain characteristic information about patient disease, once it is removed, only vague and uncharacteristic picture remain. So this is a key takeaway of aphorism 199. Never destroy an important symptom before understanding what it is trying to tell you about the patient. This is aphorism 201. In this aphorism introduced Hahnemann's most profound concept. He explained the role of vital force. When the organism is burdened by a chronic disease and cannot overcome it completely, the vital force attempts to protect life. Imagine, when the organism is burdened by a disease itself, it is not being able to overcome, then our own vital force is attempting to protect life. How does it do that? It create a local affection on the less important parts. That this I have explained earlier also. This local disease act as substitute or safety valve. By concentrating disease on the skin or other less vital part, less vital organ. That skin is itself a less vital organ. External structure, it will try to expel it. The vital force protects more important internal organ. According to Hahnemann, local manifestation is therefore not the disease itself, but only a part of the general disease. Consider it like a tip of an iceberg. As the internal disease increases, the local symptom may also enlarge in order to continue serving its protective function. Now, a very important question. What is the purpose of local disease according to aphorism 201? This is what you will be asked during Viva. If they are asking about local disease, external application, what is the purpose? Why skin disease comes? So, this is the answer which I have just told you. Now let us examine what are the aphorism of 196 to 200. Hahnemann acknowledged that a truly homeopathic remedy could be administered both internally and externally. If truly administered homeopathic means if it has been chosen correctly by on the basis of individualization. However, he warned the rapid disappearance of local symptom could create the false impression. You will believe, okay, I have cured it. The skin symptom has been gone. Hello, no. The physician may no longer know whether the internal disease has been cured or merely hidden. See, the internal disease will not say, hello, sir, I am still inside. It will not say like that. So it is still there inside. Therefore, he considered exclusive tropical application particularly dangerous because it removes the most characteristic symptoms from observation. What he said in aphorism 201, he said about nature strategy. This is one of the most fascinating concept of Organon. Hahnemann proposed that when the vital force is unable to overcome a chronic disease, it may create a local affection on a less important part of the body. So, as our body believe, our skin is less important compared to the vital organ. Obviously, it is important, but compared to the vital organs like heart, liver, kidneys, brain, So, this local manifestation acts as a protective outlet. In other words, nature attempt to safeguard vital organ by expressing disease externally. The skin lesion is therefore not an enemy, it's a signal. It's a signal. It's not making you feel ugly or irritable. It's because they want to give an indication. I need some medication for something is going on inside. So that's what Hahnemann said. Now let us understand aphorism number 202, in which Hahnemann explains what happened when this protective outlet is removed. Which protective outlet? Outlet, skin outlet. If local symptoms are destroyed through external application, the dormant internal disease is awakened like a volcano. You have removed the volcano cap. Now what will happen? The disease that are previously held in check may become active again. The suppression of local, this is called suppression. The suppression of local symptom does not cure disease. Instead, it merely removes its visible expression. Now, this aphorism forms a philosophical basis of Hahnemann opposition to suppressive treatment. How and why he was so much against suppressing a disease. Aphorism 203 is the culmination of Hahnemann argument. Nature attempt to protect vital organ by transferring disease to less important external structure. However, when physician interfere through this structure, this protective mechanism is reversed. This is the same thing which I have said earlier, aphorism. Now, Hahnemann believed that many chronic disease, this is new, chronic disease originated in this way through suppression of external manifestation, that psora, syphilis, psychosis, and the disease related to this chronic miasm, they get activated when you suppress the external manifestation. In the footnote of aphorism 203, he further states that external removal combined with dissimilar internal medicine, it actually weakens the organism, may even create artificial chronic disease. This is very important. You will get this as a short notes also. In your Viva exam also it can be asked, what is artificial chronic disease? It is because when the disease is created by the improper medicines, dissimilar internal